Hello everyone, myself Dr. Vivek Rana. I am a practicing interventional cardiologist at Jalandhar with a 10-year experience in the field of cardiology. I day-to-day manage the patients of hypertension, coronary artery disease, heart failure, and many other heart diseases. So today we are going to discuss regarding the hypertension. Hypertension, as you all know, is very clear from the word itself. There, it means that raised blood pressures. And why they are important? Because they cause damage to our organs and results in cardiovascular events, both morbidity as well as mortality. So as per the World Health Organization, nearly 63% of the total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular diseases, and which affect around 50% of the working population, that is population between the age group of 40 to 69. And raised blood pressure, that is hypertension, is one of the most important risk factors for cardiovascular diseases. What are the cardiovascular diseases? These are heart attacks, strokes, peripheral vascular diseases, etc. So moreover, it remains poorly controlled because there is low awareness about hypertension. There is lack of appropriate care through primary care, and most of the patients are lost to the follow-up. In India, the prevalence has gone up over the last 30 years as compared to what it was earlier, according to WHO statistics. Despite that, nearly half of the patients, both men and women, with hypertension are unaware of the condition. And those who are aware of the condition, still they are not properly following the guidelines directed therapy, and hence they are the medicines, they are suffering from hypertension. So the International Society of Hypertension has released 2020 Global Hypertension Practice Guidelines. They included the optimal and essential treatment paradigms attempt to address the issue that are resource poor settings, especially a country like ours, where all kinds of facilities are not available. At design the treatment accordingly so that a person sitting at a rural center where there are not many facilities available can also get an optimal treatment. So what does optimal care refers to? It refers to evidence-based standard of care, whereas essential treatment refers to the minimum standard of care to allow specifications of the essential standard of care in low resource setting. The American Heart Association has released a scientific statement in 2021 offering new guidelines for the management of stage 1 hypertension among patients with low risk of coronary artery diseases. Among low risk individuals, those who have risk less than 10% with stage 1 hypertension, that is blood pressure ranging from 130 to 139 millimeters of systolic, while 80 to 89 millimeters of diastolic blood pressures, management starts with non-pharmacological therapy. What is that? That is decreasing the intake of salt to less than 2 grams of sodium per day, or less than 5 grams of common salt per day. Then increasing the physical activity to at least 30 minutes of brisk walking or aerobic exercise 5 days a week. And these can help in reducing the blood pressure. If the blood pressure remains uncontrolled despite doing these consistently for over a period of 3 to 6 months, then consider adding a pharmacological therapy. Acute respiratory distress syndromes, especially over the last few 2 to 3 years, with the prevalence of COVID and all you have seen, it's a fatal condition which involves lung damage, and experts often associate it with severe COVID-19 infection. In recent study, which appears in Journal of American College of Cardiology, reports that using metoprolol can reduce the lung inflammation and improve the respiratory function, especially in patients who have suffered from COVID-induced ARDS. Lowering the systolic blood pressure can result in significant benefits, resulting in reduced cardiac morbidity and mortality, reduce lesser CV events in the form of heart failure, in the form of cardiovascular diseases, heart attack, stroke, and repeat hospitalization. So lowering the blood pressure remains quintessential for prevention of cardiovascular diseases. Now, with the upcoming guidelines, the increases in the use of ambulatory blood pressure monitoring and nighttime blood pressure monitoring has been emphasized. And the latest guidelines by the European Society of Cardiology as well as the American College of Cardiology tell us about the use of ambulatory blood pressure monitoring, because many a times patients present to us and they have spuriously high readings of blood pressure in the office, which is usually called as white coat hypertension. and such patients are unnecessarily being exposed to antihypertensive drugs while they do not need any, because they are suffering from white coat hypertension. And there is a subset of patients called mask hypertension. That is, the blood pressure is normal in the office settings, while they are at home or during night, it is increasing, and these patients usually end up with end organ damage. So these are the subset of patients where we need to catch them, and white coat hypertension are the ones where we need to avoid the medications. And ambulatory blood pressure monitoring is a very useful tool in identifying both subset of patients. It can improve the efficacy of the treatment and hence improve the outcomes. So most of the patients who are suffering from hypertension usually require lifelong medical therapy to achieve optimum BP control. And the 2018 European guidelines as well as 2020 international guidelines, Society of Hypertension guidelines, they recommend all 5 classes of antihypertensive drugs to control the blood pressure. To start with, ACE inhibitors or ARBs along with combination of calcium channel blockers or thiazide type diuretics are usually the first line of drug in stage 2 hypertension. So the take home message is regularly monitor your blood pressure, reduce the salt intake, increase the physical activity, and if you are a candidate who is required to take antihypertensive drugs, do take them regularly and visit your physician. Thank you.